Hello, my name is Mohammed Al Daraucha. I am a PGY 3-year resident at Ascension Providence Hospital Southfield, affiliated with Michigan State University, and I'd like to present my poster presentation of the first case reported in literature of Brevundimonas Vesicularis infection in an AIDS patient. To start with an introduction, infections with Brevundimonas Vesicularis is extremely rare, with less than 50 cases were reported in the medical literature. We did not find a single case of infection with Brevundimonas vesicularis being reported in the setting of an AIDS patient. The case report: a 49 years old African American woman with known history of HIV/AIDS presented with 1 week history of fever and generalized abdominal pain. On exam, she was febrile, lethargic, with generalized abdominal tenderness. A small, a small skin tender ulcer at the right gluteal area was noted, without discharge. We believe that this was the source of her sepsis with this bacteria. To complete our septic workup, we did 2 sets of blood culture, which grew Brevundimonas vesicularis. And to complete our workup, we did urine culture, chest X-ray, and a CAT scan of the abdomen and pelvis, but all were unremarkable. We started our patient on IV cifeprime, 1 gram every 6 hours. Patient became afebrile and improved clinically in 24 hours. Subsequent antibiotic sensitivities confirmed that bacteria was sensitive to cefepime ciprofloxacin, but was resistant to cefazolin and ceftriaxone, and of course tobramycin. Blood cultures 2 days post antibiotics initiation were negative for any growth. CD4 count was 54 cells upon admission, and we restarted her antiretroviral therapy. And as you see here, her CD4 count of 54 indicates that she is very uncontrolled HIV patient with very immune who is very immune compromised. Moving to the figures which were brought from other sources and references, Figure 1 shows Brevundimonas vesicularis bacteria, which is a gram-negative rods. Figure 2 shows a CAT scan of a previously reported case with liver abscess and sepsis caused by our bacteria Brevundimonas vesicularis. The discussion. Infections with Brevundimonas vesicularis is very uncommon, and management for such infection in HIV/AIDS patients was lacking. Our concern could be that such antibiotic-resistant organism can be acquired as a nosocomial infection. The other concern would be that treatment can be challenging if ever it became more prevalent. The conclusions. Our observation is that this bacteria has probably low virulence given the lengthy symptoms of 7 days in an immunocompromised host, with the absence of severe sepsis markers such as lactic acidosis and in-organ damage. The patient had successful uncomplicated 14 days course of treatment with IV cefepime, which is an example of how to manage such challenging infection. Thank you very much for listening.